Now on WDBJ7, it's a diagnosis no one wants to hear.
It's a day that we'll never, ever forget.
And it can be devastating. Families all across our hometowns know firsthand.
But kids know when something's wrong. Kids are very smart.
Tonight, messages of hope from families who've been there.
You always have in the back of your mind.
From diagnosis to treatment, and the attitude in between.
How do you feel?
Awesome.
Plus, new research happening right here at home.
We're trying to get down to the very fundamental basis of what's going wrong.
Personal stories and expert advice for loved ones.
And it's good to feel healthy again.
A special WDBJ7 presentation. Your Family Matters. Crushing Cancer.
Good evening and welcome to this special edition of WDBJ7. I'm Jean Jadhunt.
And I'm Kimberly McBroom, and we're joining you from a Carilion Clinic Training Center. Whenever cancer strikes, it's difficult, but when the patient is only 5 years old, it's especially tough.
Tonight, we meet a Radford boy and hear about his journey. Sutton Smith is a boy of few words.
So tell me about that.
But like most 10-year-olds, he loves video games, Fortnite, and his favorite subject is social studies.
Jamestown and the Civil War and the Revolutionary War.
He also loves riding his bike. When you see him, it's hard to believe this child was sick, very sick. 5 years ago, he could barely make the short walk to school.
When I went to pick him up, I said, how was school? You know, what'd you do? Did you play on the playground? And he said, no, I was too tired. I just sat and watched everybody.
A trip to the doctor and many blood tests later, and then the phone call no parent ever wants to get.
So we knew something was really bad.
5-year-old Sutton was diagnosed with acute lymphoblastic leukemia, or ALL, one of the most common types of childhood cancer.
I mean, you know, cancer. You hear cancer.
But the couple made a decision.
Sitting around and feeling sorry for yourself and boo-hooing about the situation is not helping anything. So let's take it head on, you know. Don't let cancer define you. And that's the attitude we took.
Within 24 hours, they had a Facebook page, Super Sutton's Great Adventure. The treatments also started quickly.
He had had a chest x-ray, he had had a bone marrow aspirate, he had had a lumbar puncture, 2 doses of chemotherapy, and had been admitted into the hospital.
The first 8 months were especially tough.
It's at least once a week injections. Sometimes it was every day, and I did the injections into his thigh.
Sutton's treatment is what the Smiths call a journey.
It wasn't just when he looked sick and didn't have any hair and was puffy from the steroids. His treatment went on for just over 3 years, and he took pills or injections every day of that.
While Anthony and Mary remember it all, perhaps the best thing for Sutton, he doesn't. A book filled with screenshots of the many Facebook posts chronicles it all.
So this says next chemo treatment in the morning. Do you remember having chemo treatments?
Kinda.
Did it not make you feel good? Or you don't really remember a lot of it, do you? That's a good thing, right?
Now, years later, those days are just a faint memory for this 10-year-old who's riding into a bright future.
Just this past weekend, we hiked Tinker Cliffs, which is 7 miles round trip.
He's a normal kid again.
An amazing journey for the Smith family. Sutton is no longer on treatment, and doctors say his prognosis is great. He is still, of course, going to the doctor for checkups. Talking about cancer is tough, so how do you talk to kids about it? Dr. Violet Borovich at Carilion Children says it's important to involve kids as much as possible in their diagnosis and treatment. She says kids are smart and they know when something's wrong.
And I've told families it's actually more important to talk to your kids about what's going on because they actually feel more fear when they're not involved, when things are happening to them without them being involved in what's going on.
Several books geared toward kids can help. Books on chemotherapy and going to school with cancer. They feature brightly colored drawings and words children can understand. If you have a sick child, you have a sick family. Cancer impacts everyone who loves the person suffering from it.
Yeah, sometimes though, as you're about to hear in Jilly's story, the experience can make a family stronger.
She doesn't act like this except when we're around a bunch of people.
How many moms have said that about their 3-year-olds? You're silly. Silly Jilly. Jilly and Travis loves talking about her favorite Disney princesses.
Cinderella and Ariel.
But a year ago, Jilly wasn't feeling so playful.
She was having night sweats and just fatigued and losing weight and not eating.
After some blood work, doctors diagnosed Jilly with acute lymphoblastic leukemia. She's now cancer-free and full of personality. Jilly still needs monthly chemo until November of next year to make sure the cancer doesn't come back. Her illness has made her parents even more focused on their family.
I took off the last year to be with her, and it's, that was a blessing that I was able to do that. I just recently went back to work doing something different, but it's, you kind of have to reprioritize.
Life's gotten more complex, but it's simplified in a way because we know it's important.
The Travis family lives in the Dublin area. Traveling back and forth to the hospital in Roanoke was rough at times.
We alternated between a hotel and the hospital. Usually one of us would try and get sleep and the other one would stay in the room and then alternate the next night.
That's an all too familiar situation for many parents with sick kids. Back in 1974, a 3-year-old's battle with cancer led her parents to help create the first Ronald McDonald House.
They just described that time of being in the hospital as being very lonely, sleeping in waiting rooms, eating out of vending machines, and of course they noticed that other families were going through similar experiences.
There are now 365 Ronald McDonald houses all over the world, including this one in Roanoke.
An 18-bedroom facility. We have a dining room. We have laundry facilities. We have families that are staying with us anywhere from, a day to 7 months.
Families who stay here must live at least 25 miles away and have a medical referral. As for the Travis family, they're hoping that the toughest days at the hospital are behind them. The experience has made them more resilient.
Not every day is going to be a good day, and being able to cope with that and find healthy ways to cope.
Jilly's year of trips to the hospital haven't only healed her, they may have also inspired her plans for when she grows up.
Whenever she plays with dolls now, she's the doctor, and they're not feeling well, so she's going to take care of them.
The Travises say they got through this with the love and support from their family and the community, and now they plan to pay it forward. Whether you're taking care of a sick child, a sick spouse, or a parent who has cancer, taking care of them can take its toll on you. Caregivers are at risk of emotional burnout, so it's important for them to also take care of themselves. Lisa Sprinkle is a senior director for home care and hospice at Carilion Clinic. While getting care in their home is often better for the patient, she says it can cause stress and anxiety for the caregiver.
When you are providing care to someone who is dependent on you for their meal preparation and their personal care and their bathing and toileting, that can be a very demanding role, and one that can be somewhat isolating.
Sprinkle says there are free resources available to help caregivers, and here are a few of them. Often volunteers from local churches, the LOA Area Agency on Aging, and hospice are willing to come sit with the patient while a caregiver takes a needed break. We sat down with a nurse practitioner with Blue Ridge Cancer Care who knows firsthand how difficult it can be for caregivers. She offered some insight on how you can help them and some signs to look out for. Jolie, let's talk a little bit about your background and why you decided to go into oncology care.
When I was 12 years old, I was affected by cancer. My grandfather was diagnosed with lung cancer when I was 12 years old. Dr. Schertz was his doctor, and I grew up wanting to work for Dr. Schertz.
Your experience with cancer personally touched you and kind of led you down this path,
Yes.
it sounds like.
Yes, and I feel like that's why I have a great connection with my patients, is because I've sat in that chair as a family member, and I know how it feels to walk out of that building and know that the loved one you're with has cancer and you can't get rid of it.
Let's talk about the caregiver, because that's a role that nobody plans to be in.
Right.
You know, it's something that just sort of happens to you.
Right.
What happens exactly psychologically, physically to the caregiver?
Basically, it's a role that you are thrown into. You may be ready, you may not be ready, but you are thrown into it. In my case, it was my mom who had cancer, so she was my leader, she was my matriarch, she was my strong person, she was who I went to when I had issues. So the roles changed, and I had to become the parent and the strong one, and it's very, very difficult.
How is the stress different from taking care of a parent versus a spouse, a child?
With my mom, I resigned from my position, and that was our deal, that I would take care of her no matter what. I was able to afford that luxury and that benefit of spending that time with her, but there are so many people who work full time. They get up, they go to work, and then they come home and they're still on. They have no downtime, they have no rest, they have no break from their role.
So that means burnout is going to happen.
Oh, absolutely.
How, if the caregiver recognizes this, like I'm exhausted, I'm physically sick or emotionally sick or just worn out, what are some things that they can do to help themselves if they do recognize this? I'm thinking that most of them don't.
They feel like that loved one is counting on them. In my respect, I also got the feedback from my mom that she didn't want anybody seeing her in this state. She didn't want them seeing her sick. She didn't want them seeing her with her facial deformity. So it was she wouldn't let anyone else in.
Thankfully, you were able to take on that role. You're that kind of person that could do that. Yeah. What if you're not that kind of person? What if you literally can't do it, whether it's you don't want to accept the reality of the situation, or you lack the organizational skills.
Yes.
There's so many reasons that people aren't cut out for it.
Usually there's a family member, a friend, a church. When my patients come to our office, I am just a huge support system. Our whole clinic is a great support system. They will find someone that will help balance them out. And sometimes it takes nothing more than someone stopping by and handing you a casserole and saying,
Yes.
I'm gone, here.
Yeah.
That was one of the biggest memories I had when I was taking care of my mom. I just was having one of those days where nothing was going right. And I've worked in oncology for 18 years, but nothing was going right. And one of my friends from nursing school stopped by and had drinks and food, and that I remember that being just what I needed at that time.
It was just that gesture, that small thing, just to give you a break where you didn't have to worry about cooking that night.
Right.
Yeah.
Right.
All right, Jolie, thank you so much for talking with us. Some great insight.
Thank you. Thank you.
Coming up, we'll take a look at how to overcome the emotional battles that come with recovery.
And there is a lot of research being done right here at home. We head inside the lab to see what a team is finding out about breast cancer.
Many of us have been there when our friends or loved ones receive their final chemo treatment or ring that bell for the final time, marking what appears to be the end of their battle.
But actually, anxiety can remain well into remission. Doctors call it cancer PTSD. WDBJ7's Liana Scacchetti shows us the tools used to combat it.
For cancer patients, a chance to ring the bell signaling the end of treatment is long awaited, but peace of mind might not ring as clearly.
Even up until the time that an oncologist tells you you're free to go to a regular doctor now, I personally still get anxiety of it's happened before. I know it can happen again.
Kathy Cockrell has been a paramedic for years, working and teaching others how to treat the toughest patients. But she's still dealing with how to treat herself. She's dealt with several cancer scares and surgeries, and while her doctors say she's doing great now, worry lingers.
You always have in the back of your mind, is this my year?
All too often, they're missing the diagnosis of what is genuinely post-traumatic stress disorder.
Dr. Robert Tressman is a lead psychiatrist with Carilion Clinic. He says many cancer patients and survivors also experience anxiety and depression, which may never even be diagnosed.
And this is a situation where your own body is turning against you. And you can't even have a sense of certainty about who you are and that your body is working to support you, because in this way it's not.
Dr. Tressman says patients or those close to them should ask, do you avoid the topic of cancer? Do you feel at times emotionally numb? Do you have dreams about your diagnosis or treatment? If so, Tressman recommends reaching out to a professional who can help.
When those are treated, they're able to tolerate chemotherapy and radiation, recover from surgery far better than those without those supports.
Dr. Tressman says the healthcare industry has room to grow in recognizing these symptoms in their patients and allowing for access to resources. Cockrell agrees.
To know that you have somebody that you can talk to unconditionally, that's super helpful.
In Roanoke, Leanna Scacchetti, WDBJ7.
We just heard from cancer survivors about dealing with PTSD, but something that could eventually help: more research.
Yeah, WDBJ7's Caitlin Francis recently spoke with some researchers at the Virginia Tech Carilion Research Institute about some potentially groundbreaking discoveries for breast cancer.
Angelina Jolie informed the world of her BRCA mutation back in 2013, putting the cancer-causing gene in the national spotlight. But what is BRCA?
So BRCA1 and BRCA2, or BRCA1 and BRCA2, are genes actually that we all have. And they participate in something called tumor suppression that should actually be protecting us from cancer in our lifetime. But some people are born with mutations in their genes, changes, that actually prevent them from doing the work that they should do.
Which leads to certain types of cancer for some people, and researchers here at Virginia Tech Carilion Research Institute are working to find out more about the gene and looking even closer at what the underlying mutation is.
So that gene is the genetic storage unit for the BRCA1 protein. And our lab works very specifically on the BRCA1 protein and how that gives way to helping cancer develop in the body.
That protein within the BRCA gene is actually found in all tissue in the body, not just breast tissue.
The protein works with a lot of other proteins in a big assembly, like a factory that is your cell. And inside this factory, there are lots of different parts that come together and exquisitely control the output of the cell toward a normal development or normal maintenance. And when one of these little parts goes wrong, anything can prohibit the assembly line from functioning properly.
Kelly and her team found an extra piece attached to the BRCA1 protein in tumors. That protein is shaped like a C, but with an extra bit that they're hoping to correct.
Our goal would be to see what we can fix in terms of its biological mechanism, and if not, can we turn those into vulnerabilities by which we can attack cancer more readily.
When we're doing a genetic test in my office, we're really talking about the genes that we were born with. So our sort of two fields run in parallel to one another, and I certainly think have some commonalities. But right now, we're still figuring out exactly what those commonalities are.
And so far, initial tests to remove that extra piece to the BRCA1 protein have been successful. If they succeed in correcting the protein, they can eventually work more closely with physicians like Lydia Higgs and reduce the level of anxiety for people who have those mutations, giving them a better quality of life. In Roanoke, Caitlin Francis, WDBJ7.
All too many people are familiar with the effects of chemotherapy, but it's a necessary evil in the battle against cancer.
But now at Carilion Clinic, they are trying a new approach. As WDBJ7's Christian Heilman reports, they are using an old technique in a new way.
By all accounts, Ben Bain is pretty fit.
I don't know, 7, maybe a little bit less. If I was running a single mile.
A 7-minute mile plus an avid biker, he's always been moving.
I always joke with people the best way to motivate somebody to exercise is to take away their ability to do so for a year.
December 22nd, 2016, he was diagnosed with cancer and forced to go through 14 rounds of chemo.
It was a lot to me.
He spent weeks in the hospital and nearly a year away from exercise.
I mean, I know what it's like to feel just absolutely awful for a year and just to not be able to do stuff.
While he was going through treatment, he was also giving input on his experience to Karen Anderson. She was developing a new program. Its goal? Reduce the number of chemo treatments by prescribing exercise.
What we're seeing is we have a lot of knowledge to know that we can help reduce the side effects, and yet it's not being prescribed.
Here at Carilion Wellness, chemo patients get assigned a physical trainer of sorts. That trainer comes up with a personalized workout routine that challenges them and helps them get stronger in their fight against cancer.
If you can get fit through a disease or a diagnosis, then it's a lot easier to manage.
Now, Ben is in remission and back to being active. He's hoping this new program will reduce pain on other people's paths to being cancer-free. In Roanoke, Christian Heilman, WDBJ 7.
Research going on at the Virginia Tech Veterinary School will hopefully lead to better cancer care for humans. Cancer is the most common cause of death in dogs, and it is very similar in human cancer. Multiple studies going on at the school are looking into several types of cancer, including glioblastoma, which is a brain cancer, and liver cancer.
But before we can get it back into humans, we're testing it out in dogs. And so the dogs are benefiting from this treatment, and then with the ultimate goal of further benefiting humans. So it's a big circle.
The school is also in the process of moving its oncology center to Roanoke. Here, the vets will work alongside cancer researchers for humans. The goal is to lead the way to better collaboration and ultimately discoveries for cancer care. We've talked about research in the lab, but how does that research make its way to the patient? I spoke with a medical oncologist from Blue Ridge Cancer Care, Dr. Jerry Goldschmidt.
Years ago, we would dream of being able to harness things like the immune system to fight cancers. Oftentimes, patients would have to go to a large center like the National Institutes of Health in Bethesda or down to Wake Forest, Duke, etc. For these types of therapies.
Now immunotherapy is available in our region. It targets the patient's own immune system to fight the cancer.
Tell us a little bit about how this has helped cancer treatment and outcomes in particular in the past 5-10 years. There are people with cancers that had no chance of survival just a few years back, and now what is going on?
So we've seen a real sea change. I can tell you just as an example, if I walk into my treatment room, which has 20+ chairs, you'll see half those patients are receiving a monoclonal antibody that targets their immune system. And these patients had cancers like kidney cancer, or liver cancers, or lung cancers that really had grim survival statistics, 6 to 12 months for many of these folks. And now, these patients are living more than just months, but years, and they're living without the side effects of chemotherapy. Their hair's not falling out, they're not nauseated, they're not necessarily fatigued. A lot of these patients are still working.
Blue Ridge Cancer Care has 10 sites, one in Roanoke, and then sites all around Southwest Virginia. So there could be a patient in Covington getting this type of groundbreaking care, correct?
That's correct. I mean, we have a site in Allegheny, Lowmore, and patients can sign up for a clinical trial for any number of disease states, colon, breast, lung cancer, you name it. We have a study for most disease states at this point.
Are you excited about the future of cancer care when you see these types of changes going on just in the past 5 or 10 years?
It's incredibly rewarding work. What's really rewarding is you're talking to patients about we used to talk about patients like, do you have anything you want to do in the next 3 months or 6 months? You need to get it out of the way. And now we're talking about seeing kids graduate, seeing grandkids, planning for that trip, and and it's really the future for a lot of these patients has been transformed.
Thank you for joining us.
Thanks again.
And for your insight. We appreciate it.
We'll be right back with some important information on when you should start getting screened for certain types of cancer.
Getting cancer screenings regularly can make all the difference, especially if you're at high risk. The United States Preventative Services Task Force recommends women who are 50 to 74 and at average risk get a mammogram every 2 years.
For cervical cancer, the CDC says women should begin getting Pap tests at 21. They also say women and men, you should begin screening for colorectal cancer soon after turning 50. Whether you've gone through a battle with cancer or you know someone who has, there are many ways you can show support in our region. Here are a few coming up. Susan G. Komen Virginia Blue Ridge is hosting its 5th Pink Promise Luncheon on Thursday, September 27th at the Hotel Roanoke. That's happening from 11 until 1:30.
And next month, the American Cancer Society is having a Climb to Conquer Cancer. That is happening Saturday, October 13th at 3 p.m. at Rivers Edge Park North.
Cancer is something that affects pretty much all of us. It's such an important issue. We hope you've enjoyed our program tonight.
I'm Jean Jadhan, along with Kimberly McBroom at the Carilion Clinic Training Lab. On behalf of everyone at WDBJ7, thanks for joining us. Have a great evening. Good night.